Thank you. Thank you so much for bearing with me for this online presentation. Sorry, I couldn't be there, unfortunately. I will be presenting today on assessing window view quality in a renovated housing building. This work was conducted in San Francisco while I was at Stanford. And yes, so I'll start with this. Yes, so why do windows matter? I think Michael already did a great job at explaining the motivation behind when having windows and how they are important for our well-being. They provide daylight, natural ventilation. They also help us reduce stress, improve cognitive performance, and they offer a crucial visual connection to the outside world, which is specifically critical for older adults who spend a long amount of time indoors compared to any other age group. And we also see that life expectancy has been steadily increasing worldwide. The number of older adults who are 60 plus is expected to double and 80 plus triple by 2050. Therefore, we need evidence-based design solutions that support health and aging in place. And specifically, windows provide that visual connection to the outdoors. When older adults are spending most of their time indoors, can help in aging in place. When looking at the literature, we see that the current research is disproportionately focused on workplace environment, as well as more towards the thermal and visual comfort. Therefore, there is a lack of research on the quality and perceived impact of view out in residential settings, specifically for older adults. The objective of this study was to evaluate how do residents in affordable housing buildings perceive the quality of their windows post-renovation, and to what extent existing quantitative view assessment framework can capture the factors that are most important to the residents, and what are the elements beyond visual ones which are currently not captured in the view quality assessment framework, but they equally influence residents' perception and valuation of their views. So we selected a site in Chinatown in San Francisco. It's a very interesting area. It's culturally very rich. It's one of the oldest and largest Chinatown in the United States. On the right, you can see the study site location, which is an affordable housing building located in a very urban environment surrounded by residential and mixed use buildings. Again, let's have a look at the study site a bit more closely. So the facade faces north, east, and west, and you have the entrance on the northeast area. So most of the windows are either on the west or east, facing either the street or the neighboring building nearby. So this specific site went through a retrofit, and that's why we selected this specific building. The goal of this study was also to evaluate how different retrofit strategies impacted residents' well-being after they moved back into the renovated building, and how can we quantify each of these retrofit strategies into their well-being impact. So this building is about 33, 4 years old, and it got renovated around 2022, where residents were moved to a different location for about a year. And this is how it looked like after renovation. It was in September 2023, and we conducted the study 10 months after residents were moved back to the new renovated building. So they got enough time to experience the renovated building. A bit more about the study building. So this building is for independent living for older adults who also qualifies for dental assistant. Mostly all the units are studio type units aimed for single or double occupancy. And there were about 31 studios having 38 residents. The type of retrofits that were conducted in the building were aimed at improving accessibility, environmental performance, and the overall quality of life for residents. The study was conducted with 22 participants. So we were able to interview 22 studios out of 31, which was a much higher turnout than we expected. Big thanks to the staff and the community there who helped us reach to that number. All the residents were aged between 65 to 101-year old. Yes, there was one resident that we interviewed, which was 101-year old. The median age was about 75 years. And the interviews were conducted in Chinese because all the residents living there were from Chinese background. They mostly spoke Cantonese with the Taiwanese dialect. And some of them also spoke Mandarin. So we had to have a bilingual translator who helped us in conducting the interviews. This is how the collected data and the method look like. So we used a mixed method approach where we conducted the verbal interviews with the residents, including closed and open-ended questions. We also captured on-site images of the window view from their residents, and we did some on-site point-in-time luminance measurement to understand the lighting qualities within their unit. And later on, we also modeled the building in Rhino to do the view out simulation using Climate Studio. With each of these method steps, we were able to collect subjective data, which were basically the interview transcription and which were then translated using the help of AI, and they were later on reviewed by professional translators. For the on-site data, we collected the image and they were processed through a segmentation model to get each of to get the relevant labels within the image in order to analyze the view quality using these images. We also ran simulation using Climate Studio to get the view quality data at floor grid level. The interview process was about 1 hour, 15-minute long, and this is how it looked like. We were doing the interviews in a community room with one researcher and one staff member. The goal of the interviews was to assess residents' well-being post-retrofit to determine the impact of retrofit strategies on their well-being, which goes beyond efficiency and performance. Some of the evaluated areas of well-being include social well-being, physical and mental health, financial well-being, and their satisfaction with the indoor environment. The view-related questions that we asked during the interviews were these three listed here. So the first one was an open-ended question where they were asked to describe the view from their windows and which street the window are facing. And then at the end, we had a close-ended question where we asked them to rate their window view quality from not at all, somewhat to very much. I want to highlight that these questions were co-designed with the Community Development Center, who were managing the property in order to ensure the appropriateness of the questionnaire culturally, contextually, and linguistically. So we tested 5 view quality framework from the literature, and we applied the view quality assessment framework from this 5 cases to our image data set in order to quantify what was the view quality for each of those captured images. Some of the common elements within these 5 framework include the content type, content distance, and the horizontal layers. So moving on to the findings, the results from our close-ended question indicated quite mixed response, where a majority of category fall into somewhat, whether they like their views or not. And we had some distribution between very much and not at all. So this answer doesn't give much detail about the reasoning behind why they like their view or why not they did not like their view. Therefore, we looked more into the qualitative answers in order to understand the reasoning behind these answers. We also looked at some different subjective rating across groups. We found that residents were more likely to keep their blinds closed if they did not like their view, and as well as the residents on higher floors like their view more often than the ones on lower floor, which is again expected, and it also aligns with the common perception. So let's look at some of the example cases where we found that the subjective data did not align with the view quality frameworks and what was the reasoning behind it. So we go a bit more into the open-ended answers. So we see that for some of these images, the view quality assessment framework indicate the quality is high. That's because of the number of layers in the views, the number of elements, as well as the content distance. But when we look at the answers from residents, we see that there is more to it than the visual elements. So there are the concerns related to privacy, related to safety, as well as air pollution, and odors keeps coming up. And there were also cases where they did like their view because they were able to see, let's say, for example, this resident was able to see the fireworks of July 4th, also able to experience the weather outside, and therefore they rated it on a higher category compared to what we found from the assessment frameworks. Looking into a bit more detail from the open-ended answer, we found that there were 5 themes that keep coming up when the residents were describing their view quality. So the first one related to safety and security, then it was about privacy. It was also about air quality and noise pollution. And then we also saw a theme related to connection to the street life, which was more on the positive side. So what really make a view good or bad? So we see that there was one specific view, which was the alleyway, which was most consistently disliked. And the reason behind it was the residents were concerned about their safety. They were also concerned about the pollution and the noise and nuisance from their windows, because it was surrounded by the restaurants and the vents really bothered them. And some of the residents did keep their blinds shut all the time, cutting off light and air. Then we also see another category of views where the lack of distance was a major concern, and again made the residents not like their view very often. They had the feeling of being watched, which compromised their sense of security. And for this reason, a lot of them decided to keep their windows closed, and the privacy was more valuable for them than light and view for some of the views. And going on to the other side, the valued views were the ones which promoted a connection to life, to nature, and to horizon. These views were highly rated because they provided a sense of connection, a depth, visual interest. So even though these views were looking out a busy street, they provided a dynamic source of entertainment to the residents, as well as they provided a great sense of connection to the street life. Therefore, the ability to see the far object was an attribute, even though the street were noisy. And to conclude and give some recommendation, I want to highlight that we observe differences in residents' perception of their life quality post-retrofit, and most of it was related to the physical surroundings. Physical surroundings around them played a key role. For example, where their unit was located, how it was oriented, on what floor level their unit was. All of these were related to their quality of life post-retrofit. We also found that the positive view feedback was closely linked to the presence of dynamic elements, sunlight, being able to see the distant object, and urban landmarks, which again align very well with the existing framework. What we saw on the negative side was that the negative view feedback was closely linked to poor air quality, outdoor noise, lack of privacy, and safety concern, which are currently not yet captured in the framework. Therefore, we need a resident-centric approach that integrate these visual metric into the social and environmental variables to holistically assess the window view quality. And also the design of retrofit that prioritize adjustable blinds, a clear view glazing with better soundproofing to align with material upgrades are recommended. And I would like to acknowledge all my co-authors, as well as the staff members of Chinatown Community Development Center, without whom this study was not possible. Thank you, everyone, for listening.